Good day everyone, I'm Joyce Trisha Vergara, student nurse from Bilian Province State University. For today's video, I'll be going to do assessment to a newborn head-to-toe assessment. The purpose of this assessment is to check if the infant is in health in good condition or have a complication or deformities. The equipments that we will going to use are the stethoscope, syringe valve, pen light, and the thermometer. The purpose of wearing gloves is to ensure the infant's safety against Vernix caseosa and amniotic fluids. Now, the first thing to do is to ensure the baby's safety in the crib or bed. There should be no harmful object that may harm the baby. The only one thing that should be beside the baby is the bulb syringe. So the use of syringe bulb is to clean the presence of mucus in the nose and mouth. Then the next is the proper way to do it. So to use the bulb syringe, we will going to press this, then put this in the baby's mouth, then release. Then press this, put in the baby's nose, then release. The purpose of this bulb syringe is to reduce the respiration from the nose and mouth. Take note, we will not going to put this on the nose because the respiration of the baby might. Next is verify the patient's information. If the patient's name and birth date are similar, and ask permission to the parents for the assessment. The first thing before touching the baby is notice how the baby is acting right now. Test the level of consciousness of the baby. Like for example, our baby here is sleeping, so the baby is not in pain. So now the first thing to do is auscultate the baby. We're gonna use the bell of stethoscope. So we're gonna listen to the normal heart rate of the baby between 110 to 160. So it's very important to listen for a full 1 minute. Next is to listen to the baby's lungs side by side. Next is respiratory rate while listening to the lungs. We need to check the respiratory rate after 30 minutes of life. The big three vital signs are heart rate, temperature, and respiration. Since we're done with listening, now we'll start with head-to-toe assessment. Let's take off the baby's hat. Just put it inside. So now, we're going to put our hands over the baby's head. Slightly. Now we're done with the head. Now we're done to the head. Let's go to the baby's eyes. We're going to shine pen light on baby's eyes. Next is that we will going to check the baby's ear. So the ear should be lined up with the baby's eyes. Check. So if it is lined up, it's good. So now, let's go to the baby's nose. So let's check the baby's nose. We will going to occlude the baby's nose here, then repeat. Check the baby's breathing if it is normal. And if you will going to see or notice some liquid, that's okay because the baby is not a normal delivery. The baby's mother is undergoing cesarean method, and if you notice that is normal. So now let's check the baby's mouth. I will going to put my finger in the baby's mouth. If the baby suck my finger, then she's doing a sucking reflex. And then I will going to touch the baby's cheek. This is licking reflex. So moving down, we're going to check the baby's neck. For weaving, maybe there is a vernix hiding. The next is the baby's chest. Is there any discoloration? Discoloration. Check the baby's arms. Is it normal? So I will going to check the baby's finger. 1, 2, 3, 4, 5. So 1, 2, 3, 4, 5. So it's normal. If the baby is skinny, it is normal because the baby just born. So I will going to check the palmar grasp. So I will going to put my finger on the baby's. Then I will going to. So now I will going to count the baby's toes. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So common abnormalities in feet is when you have extra feet that can be done by surgery. When we have the baby's toes, we can do the plantar grasp. Then alternate. Next, we will going to do the Bobinski sign. I will going to put my finger on the baby's. I will going to check the legs if it is fair, and now check the baby's diaper area. So if this baby is a girl, and the term baby, you might see a little white stuff in the vaginal fold that called smegma, and that's normal. It's fine with the baby. Don't scrub or wipe it off. Also, baby girls sometimes have total menstruation, which means changing in diapers. You see a little blood in the diapers, that's okay. That means that's mom's hormones. The hormones is circulating through the babies, and that is normal. So if this baby is a boy, we're gonna be checking the baby's penis. The meatus where urine comes out. So that should be on the tip of the penis. It could be on the other side, which is hypospadios, or in the top, it's which called esophagus. So both things are not normal and needed to be checked. So if baby is circumcised, we're gonna give proper instruction to the mom. We need to test testicles, make sure that it is descended. We're going to touch the baby's testicles. If we see that the urine is super dark sometimes. So when it comes to the bowel movements of the baby, meconium is like greenish black and tar-like, very sticky sometimes. Even wipes can take it off. As baby grows and start eating, it's gonna vary depending if breastfeeding or formula, and that's considered normal baby. It can be brown, tarry black, green, and yellow. Now wrap the diapers back. Make sure that it is below to the umbilical cord. So we're going to assess the side, the redness, swelling, or any drainage or bleeding. Now let's check the baby's back. I will going to get the baby slowly. I will going to check the curvature of the spine. Then the baby's back. Look for the Mongolian spot that is normal mark, and its color is yellowish or bluish. So now let's check the baby's temperature. I have here a thermometer. I will going to put this thermometer in the baby's arm slightly. So now I'll be going to document the findings and do aftercare. So that's all. Thank you for watching.